Good morning, folks. Welcome to another segment here on Cayman Mall Road. We are visiting the physicians at Royale Medical and Wellness Center, located in the Baytown Plaza on West Bay Road. Central location right across from the Wharf Restaurant. Many of us will know this building as the HSBC building. It's a nice, beautiful blue color. So we're being joined this morning by Dr. Malik, who's going to talk a little bit with us about this coronavirus, which has been spreading very, very quickly since the end of December. It started in a city called Wuhan in China, and so far we have at least 1,400 persons being infected by the virus. 42 persons have already died, and it's now confirmed in 12 countries with 2 confirmed cases now in the U.S. So Dr. Malik, thank you so much for joining us here on Cayman Mall Road.
Thank you for having me.
This virus is quite interesting and amazing, I think, in a number of different ways. The first thing that strikes people, I think, is just how quickly it is spreading. So it started in late December. Here we are, not even a full month yet, and we have such high numbers. As a physician here in the Cayman Islands, do you find that alarming and concerning?
I find it alarming and concerning. However, if we look at the data from other coronaviruses that have been out, such as the SARS and the MERS, the rate isn't as rapid as we found previously. So yes, it is alarming.
Right.
In the sense we should be vigilant, but it's not something that we need to be overly concerned about here in the Cayman Islands at this time.
Okay, so the coronavirus, let's just start at the beginning in terms of understanding precisely what it is. So from my basic layman's understanding, it's just a family of viruses, and we know based on the information that has been provided that it started, they suspect, actually at a seafood market in Wuhan where people may have been eating very adventurous things. And then it kind of spread from there. So it's similar to the SARS virus that was prevalent in the early 2000s, MERS, which again emerged like in 2010 and thereabouts.
So coronaviruses conventionally we believe they originate from animals. So like you also just mentioned, the SARS virus, there's the MERS virus, which we believe originated from camels. We believe there is some speculation that it originated in the market we're talking about in Wuhan, where they had seafood and mammals. However, there have now been confirmed cases of human-to-human transmission.
Right.
So, and I think that's what the worry is, and that's
Yes.
why we're all here today talking about.
Yeah. So, when you say you've got human-to-human transmission, that means now that if I've got it and I'm in close contact with persons, I'm traveling, anyone has the potential of getting it. So let's talk a little bit about what some of the symptoms are that people can look for.
Okay, so the virus that we're talking about is the worst, the people that have ended up with the unfortunate cases of the deaths that we're talking about, people that have had pneumonia as a consequence. So as any virus, you will experience the headaches, the coughs, the myalgia, the runny nose. But the worry here is it progresses to pneumonia, and it can then affect your lungs, your breathing, and cause you to shut down. And that's the target population that we're trying to educate the most. So the people that are the most immunocompromised, elderly patients, people that have pre-existing medical conditions, especially lung disease, any cardio or respiratory, they need to be extra vigilant.
Mm-hmm.
There are a few cases of it in children.
Mm-hmm.
You mentioned earlier that there's been quite a number of cases already. However, we think that that's been underreported because the majority of the people will have just dealt with a virus that they would have thought was any cold or flu-like symptoms. So the number, in fact, could be much higher than what we're seeing. However, the mortality rate remains the same. So when we compare it to other coronaviruses at the moment, the mortality rate isn't as high as, say, what the MERS was, which has been the worst one that we've had so far. And then the SARS was different because it spread so rapidly.
Okay. Now, what I found from a medical perspective particularly interesting, and I think a lot of people know this, that when you get the flu, from a medical perspective, there's very few things that you can do. So basically, you're just treating the symptoms, right?
Yeah, it's supportive treatment.
It's supportive treatment, right? So it's not like you can go out there and get a cure for the common cold or flu. You just got to ride it out, and then that means, as you've rightfully mentioned, that people with compromised immunities, whether they have an underlying illness or just because they're young or old, or I was even reading over the weekend that there was a perfectly healthy teenager who died from just the regular flu, not even the coronavirus. And what they've discovered is that in teens, there seems to be the body's immune system overreacts to the flu virus, and that can be deadly in those types of situations. So there's no cure, there's no antiviral drug that will assist people with this. And if you get this viral pneumonia, antibiotics can't even help you.
No, they can't, no. So that's where prevention is the key role here. Prevention and recognition. So you mentioned the young teenager. The treatment is supportive. Now, one of the worries that people have, and that's why when you go out there, people say see a physician, especially for young children. Don't just keep giving them Panadol and Tylenol. If it's been 2 days, the recommendation on the packaging always says see a physician. Mm-hmm. And it's because as a parent, you're not trained to see the signs that we look for when we know you're in trouble and you need that extra supportive treatment, such as fluids or worst case scenario, respiratory support. Mm-hmm. So that's what we hope that we're doing today, is just putting awareness out there, when to seek help, what to do to prevent yourself from getting any viral infections, not just the coronavirus.
Okay.
And that's why we work so heavily on the flu vaccination and the immunisation, because even though we say it's just the flu, it's still a big killer and it's unnecessary.
Yeah. And even, a lot of people, I think, don't recognize this, but even just quote unquote the regular flu, this is a special concern right now, this coronavirus, but just the regular flu, every year people die from the flu. Yeah. So the flu vaccine, which we'll talk about in just a little bit, is an important precautionary measure that people can take.
Yeah, absolutely.
All right. Now that we have confirmed human-to-human transmission, like we said, this has really spread quite quickly. So confirmed 41 deaths so far, at least 1,400 persons infected. And as you've just pointed out, even in the early days, they were saying that those numbers are always probably an underestimate because, like you said, a lot of people are not necessarily getting tested for it. It has impacted 13 provinces across China, so all of the big cities, Beijing, Shanghai. So again, anyone who's traveled, Hong Kong, Japan, all of Asia, but it's also made its way to Australia, the US. Has the UK had any confirmed cases that you're aware of?
I've had no confirmed. They are investigating. There was 2 cases confirmed in France overnight.
Okay.
So we know it's now reached Europe.
Yeah. So, I'm in the US, Chicago, Washington. So it's probably only a matter of time before it reaches our steps here in the Cayman Islands. We're a very international hub. We've got international flights coming in from all over Canada, Europe. So when people sit back, and we've had a number of persons messaging us here at Cayman Mall Road, they're genuinely concerned and worried. From the perspective of a physician, a medical professional, how worried are you, and how worried do you think the general population should be?
I think we should be wary. I don't think at this stage we need to be panicking. It's not been declared a global pandemic just yet. And I say just yet because we don't know what's to come. But I think, yes, we do, especially we have a lot of tourism here. But I think a lot of the airports are being very sensible, as are the cruise ships. So it's all about being alert and looking after yourself.
Okay. Now let's talk specifically about cruise ships, because they bring in such a short space of time, thousands of people every single day to our shores. Whereas, we may have a plane full of 200 people, we have a couple flights a day. The cruise ships, literally, if you have 4 or 5 ships in port, you could be looking at 6,000-7,000 people easily. That's a lot of people, and kind of coming off of a confined area. what precautions have the cruise ships themselves and hopefully their onboard physicians been taking?
Well, before that, I will answer that in a moment. I just want to come back to the human-to-human transmission, and we're talking about tourism. We've talked about people reaching Australia and Europe, and we're talking about confined spaces. So they're the people that have been in close proximity for a long period of time. They're long-haul flights. That's very relevant to the cruise ships as to what you've said. So yes, the cruise ship population are more vulnerable because they're in a very small confined space for a prolonged period of time. So the risk of human-to-human transmission is much higher. Somebody can sneeze and cough in a small space and then walk in somebody else. It remains airborne, we believe. There is limited data for about 2 hours. There's no confirmed cases of fecal or human transmission for what we're talking about, for the coronavirus here, but we know previously there was a few SARS cases that have had the same route of transmission. But coming back to this and having read about what the cruise ships are doing, they're being very sensible. We know a lot of the cruises that are going to leave from the affected states in China have now suspended their departures. We know that a lot of people are refunding, a lot of the companies are refunding the whole cost of the cruise to people who've been in Wuhan for the preceding 15 days. Some of the cruise ships are being sensible and they're doing screening for everybody that's coming on board, even if they've been at port. So they're doing temperatures. Anybody with a temperature over 100 are denied boarding. So they are being sensible. We have to recognise though they are at a higher risk. So for us here in the Cayman Islands, we just need to be extra vigilant. But in reality, we don't really have much close to contact with the tourists that come in. So they tend to come, they look around, and then they board the cruise again and they leave.
Okay. All right. So the basic message there is don't panic. We have heard even from the local authorities that the World Health Organization hasn't declared this as a public health emergency yet. I think they had a meeting on Thursday and they're obviously monitoring the situation very, very carefully. So the overall word there is just to be cautious, keep an eye out for any symptoms, especially in the elderly population and younger people, and contact physicians such as yourself here at Royale Medical should you feel like you need to be assessed by a physician.
Absolutely. Also, I think it's a good time to just think about people if they haven't had the flu immunisation this year already, it's still not too late. So it's something that we all need to do. What we all need to do is be cautious and try to minimise the risk of anybody here or ourselves catching it. It's a good hydration, immunity. If you can have the flu vaccine, have it anyway. It won't protect you against the coronavirus, but it will protect you against the common viruses that are out there.
Right.
So if you have any symptoms such as cough, cold, and you feel it's not resolving as you would expect it to, don't sit at home, go in and see a doctor. Right.
Now, common sense things, washing your hands often.
Absolutely, with soap and water. So the World Health Organization has just put some information out there. They're recommending 20 seconds, and we're talking about good hand washing techniques. So make sure that you're rubbing between your fingers, above and the palm. So that would take at least 20 seconds. We're talking about the contact with wild animals. While we know that there's no confirmed, it's unlikely that the wild animals here on island are going to transmit it, it's still something to just be mindful of, especially if you're travelling elsewhere. If you're going to eat meat, what they're recommending at the moment, make sure everything's well cooked, even your eggs are well cooked.
Yeah, okay. So I always am very cautious, like, I have a 3-year-old, and of course they touch everything, and then it's always the hand straight into the mouth, rubbing the eyes. At that age it's hard to control that, but as adults, just trying to be more cognizant of where we put our hands as well. So we're all handling things that contain surfaces that are very germy and have a lot of germs, and maybe we only get to wash our hands 3 times for the day if you go to the bathroom. But there are other things that you can do, like not constantly touching your faces and that sort of thing, yeah?
Yeah, and what we do recommend is if you're in a public place and you don't have a tissue or a handkerchief to hand, cough into your elbow or into your clothes to try to mop up the bacteria.
Right.
Also, if you know that you've just mentioned your young daughter, is it?
Yes.
So if you have, if you know that she touches everything, make sure everything's wiped down. I know you
Yes.
can't control that outside, but it's okay, especially healthcare facilities. We see a lot of sick people. It's very important everything's wiped down immediately. And if you have found that you're in a situation where you couldn't find anything and you've coughed into your hand, I know you may not have time, but you can also carry the alcoholic hand gels, the rubs, things like that until you get to your sink and with some water.
Okay, very good. So again, those of you who tuned into this segment, we are here speaking with Dr. Malik, who is a physician at Royale Medical and Wellness Center located in Baytown Plaza. And you guys are also offering free flu shots.
We are, yes.
Absolutely. So how can people go about coming in for their free flu shot? Do they just pop in? Do they have to call in advance for an appointment?
They can walk in if they're nearby. If they want to call in in advance, they can do as well. We do have a number of walk-in appointments on the day as well. So
Okay, very good.
whatever suits your schedule.
Yes, and of course, we have people all over the world watching Cayman Mall Road. So if you're traveling to the Cayman Islands and for some reason you come on board and you notice that you're having some flu symptoms, just remember that Royale Medical is conveniently located pretty much right on the waterfront, not far from the cruise ships. So as a cruise ship passenger, if you have an emergency situation or you just want to be assessed by a physician, you can certainly pop in here as well and speak to Dr. Malik, and they have other physicians here who can assist you. So once again, Dr. Malik, thank you so much for joining us for this special segment on the coronavirus. Like I said, a lot of people have been messaging about it and they're quite concerned. But at this particular stage, really the medical professionals and the World Health Organization are just saying to keep a watch on the situation. They're monitoring the data that's becoming available sort of, minute by minute every single day, and then they will assess it and proceed from there.
Yep.
Okay.
Okay, thanks.
All right, folks, thank you so much for tuning in. Again, wash your hands often, be safe. If you're traveling, obviously we see the entire city of Wuhan is now on lockdown. That's 11 million people that as of Thursday can't travel or really can't go anywhere. The U.S. has implemented at a lot of their key airports. They're now monitoring and screening their travelers as well, who are coming from sort of, Asian countries, because that's the hub of where all of this is happening. But it's, quite alarming that so many people now have this across 22 countries, and it's spreading really, really quickly. But do not panic. That is really the key here. They're watching the coronavirus extremely carefully, but again, prevention is better than cure. That's the medical message. Thank you so much, Dr. Malik.
Thank you.